when we were chatting about you coming onto the show, and I was asking, what do you think you might want to talk about? The first thing that came to your mind was about empowerment. Tell me why you think that
Absolutely.
that's so important, especially for adolescents, but just in general with your patients.
Sure. So adolescents are this unique age group. So they're straddling the world of being a kid and they're straddling the world of almost being an adult. And they are free thinking, they're thinking for themselves, they have opinions, they have an idea of what they want. And if you let's say that I have a patient who has depression and mom wants them on meds, they're in therapy, they're doing all the right things, and they come to me and they're really hesitant about starting a medication, which is very normal. It's great to be able to educate them on why they need to take a medication. I go into the neurotransmitters with them and how they are affected by different medications. And then we talk about the pros, the cons, the benefits, the risks of every single medication. And by doing that education with them, patients feel empowered because it's their choice at that point. I will never sit back and say, I'm the prescriber, you have to take a medication. It's, hey, we're going to work this together. We're going to figure out what is going to work best for you and what you are comfortable with, especially with the teenage patients.
Hmm. Yeah, and I guess if you can explain, because in the field of pediatrics, typically when children hit the age of 12, pediatricians are to start, prior to that visit, telling the families what to expect, a split visit, where the
Mm-hmm.
the
Yep.
the adolescent has time alone
Yep.
with the physician.
Yep.
Um, Now, my question to you is, in your practice, how do you navigate that? I mean, when you're trying to educate the
Mhm.
adolescents, are they in the same room with their parent, or do you do that together?
It really depends. If I have a patient who is more shy and they want mom and or dad there, I say this is completely up to you. I always tell the patient that anything that you and I say stays between you and I. I'm not going to run and tell mom and dad your thoughts, your feelings, with the caveat if you are wanting to hurt yourself, hurt someone else, or we're having medication changes so mom and dad know what to look for. Those are the three things that I make sure they understand. And then I leave it up to the patient. Do you want to talk about this just you and I? Do you want dad here, mom here, both, one or the other? So I really kind of leave it up to them. Most of the time, they want to see me one on one, which is completely fine. So what I will do is I will talk about why they're there, what to expect, realistically what to expect with medications. I think there's kind of this misnomer that once you go on an antidepressant, everything's supposed to be wonderful all of the time. And I set expectations that nobody is perfect, nobody feels great 100% of the time. We're looking for progress, not perfection, because nobody can be perfect.